Hello, welcome to the Evexia Diagnostics video series on ready-to-run Evexia panels. This is part 1, and will cover an overview of wellness panels. Now, the presenter for today's topic, the Director of Clinical Support and Education, Dr. Wayne Sedano.
Hi, this is Dr. Sedano, the Director of Clinical Support and Education at Evexia Diagnostics. Welcome to the overview presentation of the Evexia Diagnostics Wellness Panels. The purpose of this presentation is to discuss each panel's clinical utility and to assist you in selecting the most appropriate wellness panel. So let's get started. So here's a list of the wellness panels offered by Evexia Diagnostics. There's the Basic Wellness Panel, Standard, Complete, Comprehensive, and the Premier Wellness Panel. Now, these panels offer an array of biomarkers from the baseline biomarkers to the most advanced biomarkers. And as you may have guessed, these markers are focused on assessing the health and wellness status of your patient. Now, at its core, the wellness panels help screen for potential red flags that could compromise the health and wellness of the individual. These type of panels are also important for assessing for certain conditions, such as those that run along family lines, and such conditions as diabetes, which can be uncovered with diagnostic testing. And finally, wellness panels can provide peace of mind that can help with stress reduction. Knowing certain lab test values can encourage patients to keep the numbers in a healthy range and or to be proactive by following your recommendations. The other great feature of the wellness panel and all of Evexia diagnostic panels is that they come with a functional health report. This type of report looks for early changes in blood chemistry that can indicate the risk or potential presence of certain conditions such as hormonal imbalance, cardiovascular disease, and blood glucose dysregulation, to mention a few. Some of the benefits and features of the report include a list of optimal and standard reference ranges, a historical comparison of previous blood tests, and details about each analyte and nutraceutical recommendations. It's important to know that half of all U.S. adults have one or more chronic health condition such as diabetes, heart disease, and obesity. And knowing certain lab test numbers can help you make informed decisions regarding recommendations. And as I said earlier, wellness blood tests can help find problems before they take hold. In other words, they can help find problems earlier, that is, before they present themselves, such as liver disease, kidney disease, diabetes, thyroid disease, anemia, and cardiovascular disease, to name a few. So, as you may have guessed, the basic wellness panel includes the core analytes or lab tests, which are the foundation of the wellness panels. In other words, all the wellness panels are built from this core basic panel. And in my opinion, this panel and the Evexia standard panel should be part of the yearly health checkup. So as you see on the slide, are the list of analytes and panels included in the basic wellness panel. There's the CBC with differential, the comprehensive metabolic panel, the iron panel, which includes ferritin, serum iron, and total iron binding capacity. There's hemoglobin A1C with the estimated average glucose, lactic acid dehydrogenase, the lipid panel, serum magnesium, phosphorus, thyroid stimulating hormone, vitamin D 25-hydroxy, and a urinalysis complete with microscopy. So let's review the individual analytes and panels included in the basic wellness panel. Now we're going to start out with the CBC, which is the complete blood count with differential. That's going to provide substantial information that assists you in the diagnosis and treatment of numerous conditions such as anemia, infections, cancer of the blood cells, inflammation, environmental toxin exposure, renal disease, liver disease, autoimmune disease, and nutritional deficiencies. Now, the components of the CBC include the white blood cell count with differential, red blood cell count, hemoglobin, hematocrit, mean corpuscular volume, mean corpuscular hemoglobin, mean corpuscular hemoglobin concentration, red blood cell distribution width, or otherwise known as RDW, platelet count, and mean platelet volume. Now, collectively, the MCV, MCH, and MCHC are known as the RBC indices, which can assist in diagnosis with several types of anemia. The Comprehensive Metabolic Panel, or CMP, is a group of tests that measures several different substances in the blood that's going to provide information about electrolyte balance, liver and kidney function, glucose regulation, and the level of proteins. Essentially, the CMP gives important information about the current status of the body's metabolism. Next is the iron panel. Now, aside from the nutritional status of this mineral, the iron panel assesses for such conditions as iron deficiency anemia, excess iron supplementation, and iron metabolism conditions such as hemochromatosis. As you know, iron is a critical part of hemoglobin, the protein in the RBCs that binds the oxygen in the lungs and releases it as the blood circulates to other parts of the body. Next is the hemoglobin C with the estimated average glucose. Now, hemoglobin A1C, also known as glycated hemoglobin, is hemoglobin with glucose attached to it. The A1C test evaluates the average amount of glucose in the blood over the past 2 to 3 months by measuring the percentage of glycated hemoglobin in the blood. And this provides significant information about glucose metabolism and, when abnormal, can be an indicator of prediabetes, insulin resistance, and diabetes. The next analyte on the basic wellness panel is called lactate dehydrogenase. Now, this enzyme is found in the cells of many body tissues, especially the heart, liver, RBCs, kidneys, skeletal muscle, brain, and lungs. So, elevated serum levels of LDH are associated with a variety of disease states. Next is the lipid panel. Lipids, as you know, are a group of fats and fat-like substances that are important constituents of the cells and also a source of energy. A lipid panel measures the levels of specific lipids in the blood. Next is serum magnesium. Now, magnesium is involved in virtually every metabolic process occurring in the body. It's a component of the bone. It's needed for nerve transmission. It's an enzyme cofactor. It is needed for protein synthesis. So this is an important mineral to take a look at. Next is phosphorus. And it's important to realize that phosphorus is a structural component of bone, teeth, and it is essential for DNA, RNA, and ATP production, as well as part of the cell membrane, which is the reason why you want to know the status of this element. Phosphates are vital for energy production, for muscle and nerve function, and for bone growth. They also play a role as a buffer, helping to maintain the body's acid-base balance. Next is thyroid stimulating hormone, also known as TSH. Now, TSH is produced by the pituitary, as you know, and controls the thyroid gland function. TSH is going to provide a window into thyroid function. This hormone stimulates the thyroid by binding to thyroid stimulating receptor on the gland and initiates release of the thyroid hormones T4 thyroxine and triiodothyronine T4 into the blood. Next is vitamin D 25-hydroxy. And as you know, vitamin D is important for calcium absorption, but it has also received widespread attention for its role in preventing cardiovascular disease, type 2 diabetes mellitus, and also for immune system regulation. And the final analyte on the basic wellness panel is the comprehensive urinalysis with microscopic examination. Now, many disorders can be detected in their early stages by identifying substances that are not normally present in the urine and/or by measuring abnormal levels of certain substances. Next is the Evexia Diagnostics Standard Wellness Panel. So aside from the core analytes that I just mentioned that are part of the basic wellness panel, this panel tacks on additional health biomarkers as you see on the slide. There's a high sensitivity C-reactive protein, direct bilirubin, DHEAS, GGT, homocysteine, insulin, and the thyroid profile. So if you suspect the presence or possibility of thyroid dysfunction, cardiovascular disease, adrenal dysfunction, blood glucose regulation, you want to consider ordering this wellness panel. So let's talk about these analytes. As you know, C-reactive protein is a marker of inflammation, and studies have shown that measuring CRP with high sensitivity tests can help identify the risk of cardiovascular disease. It's important to know that CRP is a nonspecific indicator of inflammation, but it's one of the most sensitive acute phase reactants, which means that it is released into the blood within a few hours after injury, the start of an infection, or other causes of inflammation. Next is direct bilirubin. And as I said earlier, the comprehensive metabolic panel contains the analyte total bilirubin. Now, once again, bilirubin is formed from the hemoglobin that is released after the normal breakdown of RBCs, and an increase in total bilirubin typically means hepatobiliary dysfunction. Now, the two main components of total bilirubin are direct bilirubin and indirect bilirubin. Now, the level of indirect bilirubin can be obtained by subtracting the direct bilirubin value from the total bilirubin value. It's also important to note that over the past several years, studies have demonstrated that bilirubin exhibits potential antioxidant properties, preventing oxidative damage triggered by a wide variety of oxidant-related stimuli. Next is the hormone dehydroepiandrosterone, or DHEA. In a nutshell, DHEA is a precursor to testosterone and estrogens. Therefore, the concentration of DHEA will affect the concentration of these hormones. DHEA is also involved with development, growth, the immune system response, and cardiovascular function. Next is gamma glutamyl transferase, otherwise known as GGT. Now, this is an enzyme that is found in many organs throughout the body, with the highest concentrations found in the liver. GGT is elevated in most diseases that cause damage to the liver or bile ducts. This enzyme participates in the transfer of amino acids and peptides across the cellular membrane and is responsible for extracellular metabolism of glutathione, which is the main antioxidant in the cells. Next is the analyte homocysteine. Now, homocysteine is an amino acid that is typically present in very small amounts in the cells of the body. The body normally converts homocysteine into other products quickly, and that requires vitamins B6, B12, and folic acid, which are necessary to metabolize homocysteine. And therefore, an increased level of homocysteine can be a sign of deficiencies of those vitamins. Next is fasting insulin. Now, measuring fasting insulin when compared to fasting glucose can provide information pertinent about the possibility of insulin resistance, diabetes, prediabetes, as well as the level of insulin produced in the pancreas. Now, insulin is a hormone, as you know, that is produced and stored in the beta cells of the pancreas. It is secreted in response to elevated blood glucose levels following a meal, and it is vital for transport and storage of glucose, the body's main energy source. Now, insulin helps transport glucose into the cells. And finally, this panel offers a comprehensive look at thyroid function by measuring TSH, the free thyroxine index, total T4, and total T3. Next is the Evexia Diagnostics Complete Wellness Panel. This panel adds 4 additional analytes to the standard wellness panel. And these analytes include cortisol, lipoprotein A, fibrinogen activity, and apolipoprotein B. Now, cortisol in combination with DHEAS can provide significant information about adrenal function as well as immune system function, since both of these systems are interconnected. Now, as you probably know, cortisol is a hormone that plays a role in metabolism of proteins, lipids, and carbohydrates. It affects blood glucose levels, it helps maintain blood pressure, and helps regulate the immune system. Cortisol is produced and secreted by the adrenal glands. The next analyte is lipoprotein A. Now, lipoprotein A is a lipoprotein consisting of a low-density lipoprotein molecule that has a protein called apolipoprotein A attached to it. Now, the lipoprotein A is similar to low-density lipoprotein cholesterol, but does not respond to typical strategies to lower LDL-C, such as diet, exercise, and most lipid-lowering treatments. Since the level of lipoprotein A appears to be genetically determined and not easily altered, the presence of a high amount of lipoprotein A is used to identify individuals who might benefit from more aggressive treatment in the presence of other risk factors. The next analyte is called fibrinogen activity. Now, this test evaluates that part of the clotting process in which soluble fibrinogen is converted into fibrin threads. The test measures the time it takes for a fibrin clot to form after a standard amount of thrombin is added to the blood sample. The time it takes for a clot to form directly relates with the amount of active fibrinogen that is present. Fibrinogen is also one of the several blood factors that are called the acute phase reactants. The blood levels of fibrinogen, along with other acute phase reactants, rise sharply with conditions causing acute tissue inflammation or damage. Next is apolipoprotein B. Now, that is a protein that is involved in the metabolism of lipids and is the main protein constituent in low-density lipoproteins. Elevated levels of ApoB correspond to elevated levels of low-density lipoprotein C and non-HDL-C and are associated with an increased risk of cardiovascular disease. Next is the Comprehensive Wellness Panel. Now, this panel adds an additional 11 analytes to the Complete Wellness Panel. So let's take a look at these analytes. First is coenzyme Q10, which is also referred to as ubiquinone because it is found almost in every eukaryotic cell. Now, coenzyme Q10 plays an important role in ATP production or energy production, and recent findings point to a role for coenzyme Q10 to improve endothelial function, which is the lining of the blood vessels, in cardiovascular disease. And by the way, this analyte is decreased with the use or prescription of statins. Next is the detection of gliadinin antibodies, which aids in the diagnosis and monitoring of certain gluten sensitivity enteropathies, such as celiac disease and dermatitis herpetiformis. The celiac disease is an autoimmune disorder characterized by inappropriate immune response to gluten. Celiac disease antibody test helps diagnose and monitor the disease. Now, what can happen with celiac disease? It can lead to inflammation of the small intestine and damage and destruction of the villi that line the intestinal tract, which can all lead to malabsorption. The next analyte is estradiol, and as you know, the hormone estradiol is found in both men and women. Now, this estradiol assay can be used for investigation of fertility of women of reproductive age, for the support of in vitro fertilization, and for overall hormonal balance in both men and women. Increased or decreased in estrogen levels are seen in many metabolic conditions. The next analyte is F2 isoprostanes slash creatine ratio. Now, the substance isoprostane is an analyte that is produced in conditions that result from excessive generation of free radicals, including atherosclerosis and smoking and alcoholism. Essentially, this analyte measures the amount of oxidative stress. Now, the next two analytes I'm going to combine together, and that is the RBC folate that you see in the middle of the bullets, and on the bottom is vitamin B12. Now, the RBC folate, this test is used to measure, obviously, RBC and for monitoring folate therapy. Now, B12 and folate are two vitamins that are an important part of the B complex vitamins, and they work together with vitamin C to help the body make proteins. They're necessary for normal red blood cell and white blood cell formation, repair of tissues and cells, and DNA synthesis. Now, both nutrients cannot be produced by the body and therefore must be supplied. The next analyte is iodine. Now, this test is used to measure the serum level of iodine and for monitoring iodine therapy. Now, essentially, this test evaluates for iodine deficiency disorders, excessive iodine intake, or iodine that may come from exposure at the workplace. Next is RBC magnesium, or red blood cell magnesium, and this test looks at the magnesium levels intracellular, in other words, inside the red blood cells. Now, magnesium, as you know, is a mineral that's vital for energy production, muscle contraction, nerve function, and for maintaining strong bones. It comes into the body through the diet and is absorbed by the intestine. The next analyte is the essential fatty acids, omega-3 and omega-6. Now, proper balance of these fatty acids is needed for a proper inflammation and anti-inflammatory response, as well as for the health of the membranes of all of the cells of the body. Next is a measurement of total testosterone and bioavailable testosterone. Free and weakly bound testosterone, also known as bioavailable testosterone, is thought to reflect an individual's biologically active circulating testosterone. Now, elevated levels of free and weakly bound testosterone are observed in female hirsutism, and a decrease in these levels in males are associated with hypogonadism. The final analyte in this panel is zinc, and zinc in this panel is measured via RBCs. Zinc, as you know, is an essential trace mineral. Subnormal levels are associated with alcoholic cirrhosis, cystic fibrosis, myocardial infarction, acute and chronic infections, because zinc deficient patients have a tendency to have immune system dysfunction. The final Evexia Wellness Panel is called the Premier Panel. Now, this panel tacks on an additional 8 analytes to the Comprehensive Wellness Panel for the most in-depth wellness panel offered. So let's take a look at these analytes. First is copper. Copper was added due to this element being a critical functional component of several essential enzymes known as copper enzymes, which are needed for energy production, connective tissue formation, iron metabolism for the central nervous system, and for certain antioxidant functions. For example, copper is a cofactor for the enzyme superoxide dismutase. Both excess and deficiency of copper are not common. Wilson's disease, a rare inherited disorder, excess storage of copper in the eyes, liver, brain, and other organs. Copper deficiency can occur in such conditions associated with severe malabsorption, such as cystic fibrosis and celiac disease. Next is the analyte glucose 6 phosphate dehydrogenase. Glucose 6 phosphate dehydrogenase deficiency is a genetic disorder and is the most common enzyme disorder of the red blood cells, affecting more than 400 million people worldwide. The clinical expression of this condition encompasses a spectrum of hemolytic syndromes. Affected individuals are most often asymptomatic, but many patients have episodic anemia, while a few have chronic hemolysis. The next analyte is glutathione. Glutathione is a tripeptide and is the primary regulator of the cellular redox states. The critical roles of glutathione include direct chemical neutralization of singlet oxygen, hydroxyl radicals, and superoxide radicals, meaning it's a super antioxidant. Glutathione is also a cofactor for several antioxidant enzymes. It helps regenerate vitamin C and E. It neutralizes free radicals produced in phase 1 and is important for phase 2 reactions or detoxification reactions of the liver. Glutathione also helps with the transportation of mercury out of the cells and out of the brain. Glutathione is needed for regulation of cellular proliferation and apoptosis and is vital to mitochondrial function and maintenance of mitochondrial DNA. The next analyte is insulin-like growth factor 1, which can be used in conjunction with other clinical and laboratory data to assist in assessment of growth disorders. Insulin-like growth factor is low in conditions of growth hormone deficiency. Insulin-like growth factor plays an important role in tissue growth and development. As such, several studies have demonstrated the association between circulating levels of insulin-like growth factor 1 and cancer risk. Studies have shown a modest association between higher circulating insulin-like growth factor 1 levels and an increased risk of prostate, breast, colorectal, and ovarian cancer. The next analyte is lipid-associated sialic acid. Now, this is a useful marker in conjunction with the management of a variety of malignancies and in conjunction with other tumor markers. Elevated blood levels have been reported in patients with mammary, gastroenteric, pulmonary, and ovarian neoplasms, as well as those with leukemia, lymphoma, melanoma, sarcoma, and Hodgkin's disease. Lipid-associated sialic acid has also been elevated in patients with certain benign conditions, including inflammatory disorders. Next is the NMR lipoprofile test. This test is a management tool used for high-risk patients, such as in type 2 diabetes, metabolic syndrome, cardiovascular risk evaluation, and statin-treated patients. This test is used in conjunction with other lipid markers and clinical evaluation to aid in the management of lipoprotein disorders associated with cardiovascular disease. This test directly measures the number of low-density lipoprotein particles circulating in the body. Essentially, the NMR lipoprofile is different from the traditional tests that measure low-density lipoprotein cholesterol. The NMR lipoprotein test again directly measures the particles, the LDL particles, so you get a more accurate measurement of cardiovascular disease risk. Next is matrix metalloproteinase 9, also known as MMP9. This analyte is a mark of inflammation, tissue remodeling, wound healing, and mobilization of tissue-bound growth factors and cytokines. This analyte expression correlates with abnormal collagen deposition accompanying pancreatic cancer, with lymph node metastasis in breast cancer, and with regional vessel inflammation by giant cell tumor or bone. This analyte contributes to the pathogenesis of numerous clinical condition states, including rheumatoid arthritis, coronary artery disease, chronic obstructive pulmonary disease, multiple sclerosis, asthma, and cancer. And the final analyte in this panel is known as retinol binding protein. Now, serum concentrations of this analyte reflect the synthesis capacity of the liver and may indicate early malnutrition, acute and chronic hepatic disease, advanced chronic renal insufficiency, and cystic fibrosis.
Thank you for that valuable insight, Dr. Sedano. We will now briefly review where to locate the ready-to-run Evexia Diagnostics panels. When you log into your Evexia account, you are automatically taken to the dashboard. From here, click on the Test Menu tab at the top of the page. You will then be directed to the Evexia Diagnostics test directory. Although you can enter Evexia into the keyword search box, you can simply click the quick link labeled Evexia Panels under the Featured Panels and Tests column on the right, which will bring you to the different categories of ready-to-run Evexia panels. At the top of each category page, this helpful resource provides a general, overall description of why the testing is important, followed by the list of available panels in the category. Scrolling further down the page is a comparison chart. Each panel from the category is listed at the top and can be clicked to be taken directly to a detailed information page specific to that panel. Moving from left to right, you will notice the panels become more comprehensive and encompass greater clinical insight. Test biomarkers are listed in the left-hand column, allowing you to see a breakdown of the analytes included in each panel. These are also clickable links that will take you to informational pages for each biomarker. These pages provide easy access to more specific details like the turnaround time, CPT codes, specimen type, stability, and an overview of the test. If applicable, individual analytes are also listed under the Components tab below the test name, and any particular instructions are listed under the Collection Details tab. Now let's briefly review how to order these panels. First, log into your Evexia account and click on the Evexia link option under the column labeled Quick Links on the left-hand side of the dashboard. Next, find your desired patient or create a new patient. Then, click the button labeled Add New Order to open the test menu and select the appropriate panel or test. Add it to the cart by simply clicking the plus sign on the left-hand side. Finally, preview and confirm your order once it has been added to your cart and complete the process by clicking the Place Order button. You can reach us during our extended business hours between 8 a.m. and 8 p.m. Eastern Time, Monday through Friday, by calling 888-852-2723, or contact us anytime via email at info@evexiadiagnostics.com. We are always happy to assist you with any needs or questions that you may have. Thank you again for joining us for this presentation. Until next time, from everyone at Evexia Diagnostics, stay healthy, stay safe, and we wish you all the best on your pathway to wellness.